Hello everyone, so my name is Mary Turner and today I'm going to be talking about bipolar disorder. So we're going to be getting into what it is, how it affects people, the treatment for it, and really anything you need to know about living with this disorder day to day. So first we're going to get into what is bipolar disorder. So bipolar disorder is characterized by extreme mood swings that do not relate to life events. So these mood swings include a mania, which is a feeling of high energy, feeling like you're on top of the world, like you can do anything. And then there's a hypomania, which is a little bit less severe than a mania, but it's still very high energy, very talkative, very excited. And then there's also the complete opposite of those two, which is a depression. And a lot of you know what depression is. Depression itself is a common mental illness, but with bipolar disorder, the depression is a lot more severe and it can be long-term or short-term depending on the person and the diagnosis that they have. So there are two types of bipolar disorder. There's bipolar 1 and bipolar 2. So the way that these two can be differentiated is with bipolar 1, there's more manias and less depressions. So the manias are a lot more severe with bipolar 1 and the depressions aren't as severe. And then with bipolar 2, the manias aren't as intense, so they're called hypomanias, which is less intense manias, as well as extreme depressions. So both of them have the same characteristics, just in different severities. So now we're going to talk about how it affects individuals from their day-to-day lives, from relationships, everything. So the main cause of disability among young people is mental illness, this including bipolar disorder. In some cases, bipolar disorder can be very severe and it can cause you not to be able to function in a day-to-day life. This isn't the case for all cases, but again, depends on the individual. Mental health is a very broad spectrum, so you can't really categorize it as one thing when each person has its own experience with it. Alongside bipolar disorder, a lot of individuals and patients who get diagnosed with bipolar disorder get something called borderline personality disorder. And these two do come hand in hand because with bipolar disorder, you have a lot of issues with relationships and schoolwork, and this can also be transferred into a personality disorder. Now, this personality disorder cannot be treated through medication. It can be assisted and you can cope with it better through therapy. Again, as I said with relationships, a lot of relationships are very unstable when you have bipolar disorder, unmedicated, due to your quick tempers, the very intense mood swings. A lot of partners don't know how to deal with that and how to properly cope with that. It is very difficult to have a partner who is bipolar if not treated properly, but again, every case is different. So some of the symptoms of bipolar disorder, as I mentioned before, there's mania and then there's a depression. So with the mania, as I already mentioned, it's a very high energy, exciting, you're very talkative, you think you can do anything. And with mania comes psychotic symptoms. So depending on the case, some patients may see hallucinations, auditory hallucinations, they may have delusions. These are all very normal to have during a mania, as well as a depression. So in a depression, some of the symptoms can be just extreme sadness, tiredness, weight loss or gain depending on their eating habits, and again, psychotic symptoms. So psychotic symptoms go for both of them. Depending on who the person is, they may or may not experience it, but these psychotic symptoms are related to their mood. So anything that would be categorized as a psychotic symptom would be, like I said, hallucinations, delusions, which are two very popular psychotic symptoms. Those can range in a very different way depending on the person. So with suicidal ideations with bipolar disorder, a patient who is bipolar is actually 20 or 30 times more likely to have these suicidal thoughts than the general population. They are one third to a half of these patients attempt suicide at some point in their life, with 15 to 20% of those patients being successful. That number does range depending on country, economic status, gender, everything like that, but overall a general idea is that 15 to 20% of these patients do commit suicide and are successful with that attempt. With gender, so usually women are more likely to attempt suicide, but men are more likely to complete it. So this is because usually women are more open about their mental health compared to men, which is something that has definitely changed over the years. Men are becoming a lot more open, but that is all based on the social structure of our society. So men are more likely to complete it due to the fact that they use a little bit more harmful methods. Women may choose for self-poisoning, where men may choose self-harm, or they may choose overdosing, but with a larger quantity, causing their suicide to be a little bit more effective. So some of the treatments with bipolar disorder. So this is actually a chart that shows the different types of suicide ideations and successful suicide rates with bipolar disorder compared to the general population. So as you can see, that people who are bipolar have a very high rate of suicide compared to the general population when off medications. This is due to their very unstable mood. This can be caused by many different things, but more of the time when you're unmedicated, when you're bipolar, you have a lot of big mood swings, which causes you to be very impulsive. So now we're going into treatment. So the treatment for bipolar disorder is usually medication. That is mainly the main focus of treatment, but there can also be therapy. So with medications, there's two different types of main medications that psychiatrists usually prescribe to people who are bipolar, and that is a mood stabilizer, as well as an adjunct medication. So an adjunct medication is usually categorized as something that is specific. So that can be an anti-anxiety, an antipsychotic, or an antidepressant. The issue with antidepressants is it only cures the very depressing part of bipolar, so you're constantly at a mania. So that usually isn't used a lot. The antipsychotic is usually a very popular medication when treating bipolar disorder, as well as anti-anxieties as a side medication, but the antipsychotic is usually the main one. And mood stabilizers are just a general medication that are used to treat everyday moods. They're not usually as successful as the other types just because they're so generalized, where the other type is very specified. There's also therapy that is very popular. So there's DBT therapy and CBT therapy, dialectal behavioral therapy and cognitive behavioral therapy. These are usually the two main types that are chosen. And then also shock therapy, which is a small current that goes through your brain to try and redirect the path of the electrodes. That's not used very often. It's very controversial. Alright, so I would just like to say thank you for paying attention, and I hope you guys learned something. If there's any questions or concerns, please direct them to myself. My email is listed here if you would like to pause the video, and I hope you guys have a great day.